All right, we've got a good group. I think we can get started. Thanks, Wes. Hi, everyone. Welcome. Thanks for joining either during your lunch hour or your late afternoon. My name is Jessica Ortiz with the Center for Care Innovations. I'll be kicking us off today for our August AI in Action webinar focused on navigating AI adoption in safety net healthcare, real world insights from the Practice Network. And I'm really excited that we'll have Senna and Ciera joining us today to talk to you all about what they're learning in this program and have time for some Q&A at the end. So just really quickly, if you can go back to the last slide real quick, Wes. This AI in Action series is brought to you by the Center for Care Innovations, Health AI Partnership, and Alliance Chicago, and it's also supported by the California Healthcare Foundation. So like I said, we'll have time for a presentation from Senna and Ciera, and then we'll have some Q&A time at the end. So please feel free to put your questions in the chat along the way. Also, just some housekeeping. Please mute yourself if you are not speaking during the Q&A portion, but please chat away in the chat box. We want to hear from you throughout the presentation. If you have an AI note taker, please disable that. We have Zoom AI enabled for this call, and we'll be sharing all of the resources in the follow-up after the meeting. If you have any tech issues, Wesley Gabriel is here to help you. He's put his hands up there. Reach out to him privately if you need some support. All right, so I'm going to introduce our speakers and then hand it over to them. We have Senna Podro from Health AI Partnership and Ciera Thomas. They're both research and product managers at the Duke Institute for Health Innovation and Health AI Partnership. And I'll pass it over to them to share anything else that they'd like to about their backgrounds and then kick us off for our presentation today.
Thank you so much, Jessica. Hi, everyone. It's great to be with you. My name is Senna, and as Jessica mentioned, I'm a research and product manager with the Health AI Partnership and the Duke Institute for Health Innovation. I have a background in global health and innovation, and I just love everything healthcare. I look forward to today's conversation.
Hi, everyone. My name is Ciera Thomas. I'm also part of the Health AI Partnership and DHI teams, and responsible for coordinating the day-to-day operations of our technical assistance program, the Practice Network. So really excited to be here with you all today and to share kind of what we've been learning from our amazing site teams over the last few months.
Thank you. So here's a quick agenda for today. We'll talk about the Health AI Partnership, how it started, our programs. We'll go over the Practice Network, and then we'll jump into a case study to better understand the learnings from the Practice Network, and any future directions that we have in implementation. Next slide, please. So what is the Health AI Partnership? We are a national collaborative that was founded in 2022. We got funding from the Gordon and Betty Moore Foundation to do this work. And really, we've been centered around empowering healthcare professionals to use AI effectively, safely, and ethically through community-informed, up-to-date best practices. And part of this is this larger vision really to be an up-to-date source of actionable guidance for our healthcare professionals when they're using AI. And we're guided by values that include eliminating the digital divide, improving patient care, improving the workplace for our healthcare professionals, and very, very importantly, also building this community of practice. Next slide. So as you're probably aware, there's several organizations in this space, but what really sets us apart from all these other organizations is, first of all, we amplify the voices of different healthcare delivery organizations. So we're talking from safety net organizations all the way to academic medical centers. And part of this work is also best practice development and making sure that this is available in support for both high and low resource environments. And we do this through a multidisciplinary stakeholder team. We have clinicians who are doing this work, operational leaders, people in policy and advocacy, to make sure that we're getting all these perspectives that inform and shape resources that are being shared widely in our community and publicly. And then also providing AI implementation support services for both high and low resource environment, including our practice network that you get to hear more about. And lastly, also involved in policy advocacy by raising awareness and building local capacity. So this is our community of practice. We currently have 35 plus organizations. So we have healthcare delivery organizations in our core network, and these are the academic medical centers that are more well-resourced and advanced in their AI adoption and implementation practices. Then we have ecosystem collaborators that include professional societies, health plans, CCI, of course, that we've partnered with for this amazing event. We've also got federal observers for our regulatory contributions, and then very, very importantly, our practice network that focuses on the safety net community. Next slide. So these are some ongoing HAIP programs. At the center of our work is making sure that we're democratizing AI through this community building and also enhancing AI readiness. So we have our community of practice. So this is the core network, the practice network, the ecosystem partners that I talked about before. And for the core network and practice network, we organize these virtual meetups to make sure that we're fostering these peer learning communities, and we also provide opportunities for exclusive events as the AI implementation landscape changes to make sure that they have opportunities to learn from each other and also from experts in the field. And then we hold three very important education events. So the very first one, the AI Hub, is our event that focuses on AI implementation, lifecycle management practices. In the past, we've had everything from patient concerns and data privacy all the way to who is liable in implementation, and also to LLM monitoring. So this is a wide range of events and speakers that we get along the AI lifecycle management process. The second event, which is a real world AI series, is in collaboration with Kaiser Permanente's Aim High initiative. And this really focuses on AI implementation and evaluation. So this usually has a focus on clinical trials. So the one that we have coming up in September is going to look at the very first RCT on generative AI psychotherapy tool. These are examples of those kind of events that we have under real world AI. And then lastly, our AI in Action series, which you're very much aware of because you're attending that right now. This is in collaboration with CCI and with Alliance Chicago that focuses on practical implementation for safety net providers. And we're really excited about all these education events. You can find them on our website on healthaipartnership.org. Then we also have several advocacy opportunities that come up through our community. Some of my colleagues have been involved in Senate testimonies and Capitol Hill visits, involved in discussion forums that really shape policy and regulation around AI. And we've been able to contribute to policy briefs in this space as well. And then another thing that I really wanted to highlight here is the co-creation of resources. So part of this community of practice is making sure that we have a pulse on how the AI in healthcare implementation landscape is changing, and also to figure out what resources are most important for our community of practice as they are in the front line of implementation. So in the last few months, we've been working really hard on a vendor disclosure work group as we think about information exchange between vendors and health delivery systems and have put together a vendor disclosure framework, which I'll talk about a little later. And other resources that are notable here too are currently working on AI risk assessment frameworks to help guide our health system. And in the past, we've also created case-based ethics training for physicians as they think about the ethical implementation of AI tools in clinical practice. And very importantly as well, we want to make sure that this knowledge that is being created, these resources are disseminated and shared publicly through our publications, through opinion columns, media relations, and invited talks. So I've said a lot about, I think I've mentioned core network a few times, and wanting to make sure that you understand what constitutes the core network. These are healthcare delivery organizations partnering in the development of AI lifecycle management and governance best practices. So we work hand in hand with these organizations, largely academic medical centers, to optimize these best practices by sharing learnings from the implementations of AI systems. A lot of our core network site leads are both clinical and operational leaders, have experiences in implementation and are able to share that with us as we develop these best practices. And then we disseminate this knowledge by collaborating further in this content development. And then also making sure that this is all in collaboration for advocacy, for resources in order to make sure that we're scaling the responsible adoption of AI across different settings with different levels of readiness. So some health AI partnership products that we have been able to put out publicly in the past. The first one being our 8 key decision points framework, which outlines best practices for AI adoption. So looking at 4 different phases of AI adoption from procurement, development, and adaptation to integration and lifecycle management. And this detailed guide can actually be found on our website as well if you'd like to take a closer look. Next, please. Thank you. We also have our health equity across the AI life cycle framework that was developed for assessing and mitigating the potential of AI worsening health disparities. This is a step-by-step guide that will help health systems identify different sources of bias across stakeholders, across data sources, and making sure that there's practical guidance on how to mitigate these biases. And then moving on to products that are for specific audiences within the health systems. So a multidisciplinary team from the Duke Institute for Health Innovation developed this model facts label that is a nutrition style label tool that presents model information, particularly for clinical end users at the point of care. So in this case, you're looking at what the model does, what it does not do, how it performs, what the warnings and limitations are. I know this figure here is very hard to read, but you can find this on our website as well. Just wanted to show you the format of this collecting relevant information for clinical end users. And then lastly, our vendor disclosure framework, which was created to facilitate information exchange between HDOs and vendors. So as I mentioned before, this health equity across the AI lifecycle framework, as you can see, it's very detailed step-by-step guidance. And it does reflect the complexity of identifying, assessing biases and mitigating them across the entire AI lifecycle. But we also want to mention that this is very practical guidance and it's actionable that can be useful to health systems as you take a look at fairness evaluations and identifying bias within AI systems in adoption and implementation. Next slide. And the model facts label, I think the picture is a little clearer here, but the purpose really of this was to collate relevant, actionable information about AI tools to inform clinical end users. And this is in compliance with the HTI-1 final rule, which mandates that health IT developers disclose algorithm information to purchasers. So for our vendor disclosure framework, this was developed to solve a two-part problem. The first being that there's unclear evaluation criteria on the health delivery organization side of things, not knowing exactly what the right questions are to ask in vendor engagement, and also insufficient disclosures from the vendor side of things. So we put together a work group with three institutions in our core network. And these site leads have already been involved in vendor engagement processes internally. So together we came up with these 5 assessment domains that will help health delivery organizations in this information exchange with vendors. So just going clockwise here, in the system capabilities and intended use domain, there are several questions around the functionality of the tool, the use of the tool, affected stakeholders. Then you move on to system performance and compliance. And these are the questions that are a little bit more common in vendor disclosures, where you're looking at performance metrics, potential biases, any associated risks, and then regulatory standing. The third domain, being the data stewardship, is highlighted here because it came up as something that was very important to our health delivery organizations and not spoken of enough in these conversations around vendor engagement. So they wanted more questions around data security, privacy, quality assurance, secondary use of data, and any retention policies that the vendor has. And then, of course, we have to think about the integration of these tools into different workflows. I think a lot of health systems had underestimated the cost of ownership of these tools. So we have several questions around the total cost of ownership and implementation timelines for them to have a better sense of what integration requirements will be needed. And then lastly, thinking about sustaining the deployment of these tools, lifecycle management, asking questions around what types of ongoing support or monitoring and maintenance do vendors provide post-implementation. Next slide, please. So this is just to show you the structure of the vendor disclosure framework. We have domain descriptions, as you can see here on the left. We have subdomains where and with direct questions where we're asking questions such as, in capabilities, what does the AI system do? But also providing supportive descriptive statements to help health systems assess what a comprehensive response would look like. So under capabilities, we're asking that they provide detailed documentation on what the AI system does and specific functionalities of it. And this is the same structure for each of the 5 domains. Next slide. So the HAIP Practice Network, which Ciera will talk more into detail about what they've learned, but just to introduce you to what this is, these are healthcare delivery organizations who have been adopting AI solutions in partnership with the HAIP Core Network and the Coordinating Center in order to apply the best practices that I spoke of at the beginning of this presentation. So they're implementing best practices, they're disseminating knowledge by sharing learnings, engaging in collective advocacy that's required for scaling adoption across different settings, and also facilitating a peer learning network where they get to meet and share experiences and strategies as they think about implementation. So why do we need a practice network model? I think we can all agree that there are capacity gaps. Many clinics lack in-house staffing to navigate this landscape of regulation and governance. Often, guidelines come out, best practices, and they assume that there's technical capacity for this type of work. And this does not necessarily reflect what the reality is. We also want to make sure that we're getting input from these frontline innovators within the safety net provider community. And this is all to make sure that we're not deepening disparities that already exist. And we're very much aware that this will require the infrastructure training, expert access, and also peer learning networks to help build these implementation pathways. So this is a inaugural cohort of the Practice Network. They started out September of last year and will be closing out this September. But we have four FQHCs, one community hospital. So we have North Country Healthcare, which is in Flagstaff, Arizona, and they're implementing an ambient scribe. We also have Community University Healthcare Center in Minnesota, implementing the risk of patient no-show algorithm. We have Health Center of Southeast Texas, also adopting an ambient scribe. San Isidro Health in San Diego that's adopting a diabetic retinopathy screening. And then lastly, Wake Med here in the Triangle in Raleigh, adopting a sepsis prediction algorithm. And I will pass it over to Ciera.
Hi, everyone. So I'm going to take us through kind of a case study of how the practice network sites have been implementing AI tools with the context of this key decision point framework. So as Anna mentioned, the 8 key decision points are our flagship framework that provides guidance throughout the AI lifecycle, from identifying the right clinical problem to long-term monitoring and decommissioning. And this framework really covers 4 phases, so procurement, development or adaptation, integration, and then lifecycle management. And I'm going to kind of spend the rest of our time today walking through each of these decision points, including key questions to ask at each of these points and examples of how practice network sites went about adopting and implementing tools using these decision points and the questions that they raise. Next slide, please. So, the first step in responsible AI adoption is really seeking to identify and prioritize the right problem. And that means really looking closely at the clinical, operational, and administrative challenges that organizations are facing every day and asking, is this a high priority issue? And one, could AI realistically help solve it? But also, is AI the right solution for this problem? Or are there other tools that we could explore? So, at the beginning of the site's engagement with the practice network back in September, we conducted detailed scoping meetings with each site, where we delved in depth into the dimensions of the problems that they were facing, why they came with a particular AI tool in mind, and also really trying to understand the context behind their organizations. So, their current attitudes towards emerging technologies, the types of patient populations that they work with, the geographical contacts that they exist in, and the types of partnerships that they have available. And really just trying to get a better picture of their overall goals for AI implementation. We took all of the information that we gathered from them in these scoping meetings and created detailed project plans for each site following the key decision point framework, which you'll see on the left. And then, as you'll see on the right, we also created milestones for each of the site's AI adoption and implementation processes that, for each of these decision points, broke down specific and actionable steps that they could take to get through those steps. So we also created additional milestones under KDP1 for the site that was looking to implement the risk of no-show tool. And that was really in order to strengthen their understanding of their patient population. And I think we wanted to do that so that they could have a better idea of what support that they were already providing to their patients, the outreach strategies that they were already employing, the different types of wraparound services that these patients were already plugged into, and then what steps they could potentially take beyond that when the model alerted that a patient was likely to no-show. So once we've identified the right problem, the next step is really to define the AI tool's scope and intended use. So we need to be really crystal clear about what the tool should and shouldn't do. And that means kind of asking what is the primary function of this tool? Why is it being employed? And in what situations should it be used? And when are there cases where it's not necessarily as appropriate to use the tool? So, using the information that we gathered in those scoping meetings, we also developed quick and clear intended use statements that were designed to be a kind of focusing point throughout the entire AI adoption and implementation process. So, we came back to these statements later as we were developing success metrics to remind ourselves of, why are we looking to use this AI tool? What are our primary goals in using it? And we also gathered information about the types of resources that the organizations had available within their internal staff. So, what human, technical, and financial resources were available to support AI adoption, as well as what resources and support could they gather through existing collaborations, both through the practice network, but also through other relationships that they have with other organizations. And each site applied to the practice network at a different stage in the AI adoption process. So some kind of applied with a specific use case in mind, others applied with a specific tool for that use case that they were wanting to use. And so for those organizations that hadn't already picked a tool, we supported them in conducting rigorous vendor evaluations. And that was kind of the start of this curated resource library that we developed. So we set up this resource library with links to publicly available tools, for example, the Elion and Avia product marketplaces, but they also included links providing early access to tools that HAIP had in the works. So the sites were able to use the early drafts of the vendor disclosure framework, and we were able to actually kind of take their experiences and using that series of questions and refine the framework further to make sure that we were capturing kind of the implementation realities of safety net organizations and the types of questions that they needed answers to. So we also set up office hours with other organizations in our community of practice, and you can see some of the office hour hosts in the table below and the different types of expertise that they provide, including on regulatory matters, product testing and liability, patient and community engagement, as well as data governance, digital transformation, and different types of EHR systems. So these organizations were able to provide really nuanced guidance on a variety of topics depending on their kind of domain of expertise, including suggestions that built off of that vendor disclosure questionnaire that we provided to include criteria for or to include criteria for what types of questions to ask third-party vendors, as well as strategies for negotiating contracts for trials of their tools. And so the third step is defining what success looks like and how we're planning to measure it. So once you have kind of an AI tool in mind, we need to establish what counts as a win, both clinically and operationally. So what are the key metrics that we're wanting to track, and how will we know that the tool is actually making a difference within the system? So HAIP worked with sites in our biweekly check-ins to develop success metrics across three domains. And those are satisfaction, operations, and outcomes. And you can see a sample of some of the metrics that we used for AI scribe adoption below across those three domains. So looking at satisfaction, not just of clinicians who are the end user here, but also of patients. And then from an operational perspective, note quality. And when we're looking at outcomes, some of the metrics being assessed included, the daily number of open desktop items, time to close the clinical visit note, time spent documenting after hours. And there are different methods of assessing these tools. So sites that were working on similar use cases were also able to share their plans and the types of metrics that they were planning to collect with each other to provide suggestions on different types of reports that could be run and just to kind of facilitate the overall adoption process. So step 4 is about designing the AI solution workflow. So we need to map exactly how the tool is going to fit into day-to-day operations, identify who will be involved, and make sure that the workflow is optimized to the different stakeholders that are involved in using the AI tool. And so that kind of means asking, how would providers actually use the tool if they are the end user, or how would the end user use the tool, and how is this going to change the current process? So for this decision point, we were able to share the algorithm journey map paper with sites, and I'll put the link for that in the chat. But the algorithm journey map paper was something developed by DHI when we were looking at sepsis prediction algorithm implementation within the Duke Health system. And it provides example diagrams for how to map existing processes, changes, and the different stakeholders involved. And there are legends within this paper to show like the different domains of changes to processes, changes to the roles and responsibilities of individual stakeholders, and how technology implementation is changing existing technological workflows. Each participating practice network site was also paired with 2 mentors from within HAIP's network of core sites that Senna described earlier. And we selected the 2 mentors with the idea in mind that they would have implemented the same or a similar AI use case in the past. And so these mentor sites were able to share kind of their own workflows for each AI tool and suggest different factors for the sites to consider when mapping changes to their workflows. Like, for example, with clinical decision support tools, what are different pathways of response when you have a false alarm? Who should be involved in those processes? And how do we manage alert fatigue? Um, Next slide, please. And step 5 is about generating evidence of safety, efficacy, and equity. So it's not enough for an AI tool to simply work. We need to know that it works well in our specific setting, that it works fairly, and that it works for all the different types of patients that you're serving. So that means collecting and analyzing data to see how it performs across different patient subgroups, and checking to see if providers can validate its results. So for this decision point, in order to generate this evidence, the sites were looking to locally validate models through small pilots, usually of around 8 to 10 end users, which tended to be kind of the provider population at one individual clinic in these multi-clinic systems. So we worked with sites during our check-ins to develop plans for these pilots, which included developing provider training and education materials, end user and patient surveys, as well as communication materials for disclosing or consenting patients for patient-facing tools. Um, we also developed plans for how to evaluate those success metrics that we identified in key decision point 3. So what types of reports were we going to be running, at what intervals, and then what was the plan going to be for when and how to evaluate changes from baseline towards the end of the pilot. And in addition to us working with our practice network teams to co-create these plans, we were also able to review those with office hour hosts. So, for example, the CCI team has tons of experience in digital transformation in the safety net, and so they were able to provide some really great feedback, as was our community engagement representative, who was able to review some of those patient communication materials and point out, language that might be alienating to patients, or ways in which we could explain things in a way that was a bit clearer or a bit more receptive. And some office hour hosts were also able to point out, different liability risks, and suggest strategies for how to potentially mitigate those risks. So decision point 6 is about executing the AI solution rollout. So once we've piloted and we've decided that you do want to scale the use of the tool past the pilot duration, you can't really just turn the tool on and expect it to just work miraculously. We need to make sure that end users actually use it, that they trust it, and also that they understand it. And so that requires rolling out, targeted education, not just specific to the tool, but if your providers or end users don't have an understanding of AI, to start with, how do we build that basic education? As well as providing then hands-on training on the specific tool itself, and employing solid change management strategies so that staff feel, really supported throughout the entire implementation process. So to date, most sites are in the process of completing pilots of their AI tools, and in the process of gathering data on those success metrics that they have identified, and will make determinations in the next couple of months of whether they want to get to this decision point and kind of roll out the tool that they are trialing past the duration of the pilot, or if it's not the right tool for them and if they're ready to look for something else. However, for example, with ambient AI scribes, we've seen in the past that a scribe might work well within one clinic within an organization, but might not work as well within a different clinic, just because you have different staff populations there and the buy-in of those individual end users might be different. And I think that really highlights the fact that, AI adoption and integration isn't just about the technology, it's also about the people and the processes that are in place to support the integration of that technology. So for decision point 7, it's all about monitoring the AI solution. So implementation and integration of the tool is really just the beginning of the process. And that's where kind of the next piece of lifecycle management comes in. So we need to track how the tool is performing over time, whether it's continuing to meet those success metrics, which we determined in decision point 3, because performance can drift over time, both as the model's performance shifts and as your patient population shifts. And so this requires ongoing monitoring and evaluation so that we can identify any performance changes really early on and then respond appropriately. So with ambient AI, for example, we might see a steady improvement in documentation efficiency in the months after it's been implemented, as well as better patient and provider satisfaction. And that would usually tell us that not only is the tool working to improve that documentation efficiency, but also that workflows are improving as providers are becoming more comfortable with the technology and finding tips and tricks that work well for them. So our last decision point is about updating or decommissioning the AI tool. So we need to know when it's time for an upgrade or when a tool is no longer the right fit. And that's not just a decision that you're making, at the point of when you conclude the pilot, but it's a decision that we should always be kind of continuously evaluating. And that really requires clear criteria and clear review processes so that, decisions about whether to update a tool or whether it's time to sunset it are based on evidence rather than assumptions or perceptions. So, for instance, we might update ambient AI scribes when a new version offers new language capabilities. However, if we're noticing through our continuous monitoring systems that a tool has started to underperform against those success metrics for an extended period of time, and that any efforts to improve performance aren't really showing those improvements towards those success metrics, then it might be time to sunset the tool. So those are the 8 key decision points, along with some of the actions that the Practice Network sites have been taking at each step in the AI adoption and integration process. We really hope that these decision points are the pivotal pieces of the AI adoption lifecycle, and that the guidance documents that we've provided are able to kind of facilitate really actionable and step-by-step processes for adopting and implementing tools. The framework was developed with those 30 plus organizations in our community of practice, and so is informed by a lot of different organizations working in very different contexts and with very different patient populations, which we hope makes the tool, pragmatic and easily applicable for informed decision making. And then, of course, it's a free resource, so please take advantage of it. We hope you find it helpful, and you can access the framework by scanning the QR code on the slide or by accessing the link that Wes dropped in the chat. We also have this handout that we've recently developed that kind of breaks down each decision point, the key actions to take, different tips and tricks, and the ways in which providers can be a part of this process and kind of champion AI adoption and responsible use within their organizations. So, kind of going back to the practice network, I wanted to highlight some of the key things that we've learned from the sites over the last several months. So in addition to all of the steps that they have taken to implement their specific AI tools, they're taking a lot of steps to build capacity for sustainable adoption, not just for this use case, but also for future implementations of AI. So a lot of the sites are taking steps to develop data, governance systems and policies, which CCI has some fantastic resources around that we've been able to plug them into. A lot of them are also taking those existing data governance policies that they have and figuring out how to scale them to implement AI governance policies and systems, as well as developing specific review committees with support from HAIP, different guides that we have in the resource library, and tips and tricks from the office hour hosts and their core site mentors. And two sites have also started adapting their HIT ticketing systems to be able to better screen incoming requests for AI tools. I know every health delivery organization I've talked to is getting so many requests for new products as this AI hype kind of sweeps across the landscape. And so really evolving those systems in order to better screen those tools, evaluate what is already in place, and how potentially tools could align with their existing organizational priorities. And three sites, as I mentioned, have already begun the process of piloting the AI tools that they selected, with the other two planning to pilot in the next 2 months. So we're excited to see kind of how these pilots wrap up for them, and what steps they choose to take next. So, looking towards the future, through the practice network, we've learned a lot. And we've really learned that in order to close the AI readiness gap, health delivery organizations, particularly in the safety net, really need additional support to build organizational capacity for adoption and implementation of AI and just other emerging technologies. And we've learned that collaboration is really key. So sharing resources and strategies can really accelerate responsible AI use, especially when it's coming from, a broad community of stakeholders that are able to offer insights and guidance on so many different aspects of the AI adoption process. And the Practice Network is helping lead this effort by offering hands-on technical assistance to safety net providers free of cost. But to reach the over 1,600 FQHCs and other safety net organizations across the country, it's really important for us to be able to scale these efforts to ensure that the potential benefits that AI has to offer are accessible to all types of health delivery organizations. So we hope that the a key decision point framework for AI lifecycle management can serve as a free and accessible starting point for all HDOs to think through what responsible AI adoption looks like within their specific organizations. Um, but as this first cohort of the practice network wraps up, we're also planning to continue implementing this model with regional cohorts in the future, and a next practice network is based specifically in California. So if you are interested in participating in that cohort or in participating in a practice network program, please stay tuned into the work that HAIP is doing. And that takes us into different ways to engage with us. You can join our community of practice by visiting healthaipartnership.org/join us or scanning that QR code. And that'll sign you up for our monthly newsletter, where we share ongoing events like AI in Action, but also our Health AI Hubs and Real World AI series, and where we push out different events and resources that are becoming publicized. You can also sign up and attend our monthly education events by visiting the healthaipartnership.org events tab or joining and following us on LinkedIn. Thank you so much, and we'll be happy to take any questions.
Thank you so much, Ciera and Senna. I think I would say a huge round of applause. There's a lot of content and a lot of new information that we're now learning about, but also I think more importantly, all the different resources that you all are sharing with us and how accessible it is. So we just want to thank you from the safety net that you're being able to not only engage those academic medical centers that are over or highly resourced, let's put it like that, rather than over, but being able to filter that in a way to engage those safety net organizations that are looking to implement. So thank you so much for sharing that. I'm gonna ask the audience to put questions in the chat, that would be great. I do have a couple of questions that did come up. One of the questions that came up as folks were registering for this event or webinar was, how do safety net organizations plan and manage budgets and revenue models to support AI innovations? Was that something that came up through the course of the practice network?
Yeah, I think that was part of our work at the beginning to assess the level of internal resources that were available for AI adoption. So I think every organization approaches this a little bit differently, whether they primarily fund it through grant opportunities or whether they set aside part of their operational budget, IT budget. Um, yeah, I think it's very specific to the organization and kind of what their IT priorities are. Senna, I'm not sure if there's anything you'd like to add there.
I think that covers it. Thanks, Ciera.
Another question that came up here are, how are organizations sourcing capabilities? And this really relates to this question around like build, buy, partner, or outsource. And I wonder if you could share a little bit more of like, given what you're seeing within the practice network and some of the other safety net organizations that are coming across, what it seems to be more common, just given their particular use cases and or needs based on the problems.
I think I can start us off and Ciera provide a little bit more detail. I believe for the current practice network, there's no capacity to build in-house tools. They're outsourcing to external vendors. And so part of that is actually being able to better understand what capabilities are needed for that vendor engagement process and making sure that they're able to also leverage what they have and use that in that negotiation. We know from the core network experiences that there's more negotiating power just because they've been partnering with vendors longer and implementing these solutions. So part of the vendor engagement framework process was to also better understand how to support capabilities of the safety net, as most of them are not building as compared to the core network.
Yeah, I think one of the points Senna just stated that I'd like to really highlight is um, the leverage that safety net organizations have in these vendor negotiations. I think we've seen that be challenging where bigger AMCs have larger provider populations, so they're signing these bigger contracts. And sometimes that means that for the vendors, they're not offering the same levels of customization or they're not able to be as flexible in the types of contracts that they're offering. So that's been a challenge and one that we've been trying to work with some of our community of practice partners to provide suggestions on like how can we approach contract negotiation to really level set and try and obtain the most equitable arrangements we can. Yeah, as Anna mentioned, a lot of the organizations in this first cohort didn't necessarily have the capacity to build. And I think that reflects the fact that there's a lot of diversity within the FQHC and safety net space. So I know that's not the reality for every organization. A lot of the decisions to buy and partner reflect that fact and reflect the types of capabilities that they had internally. So if you don't necessarily have a whole data science or IT team, it's a little bit complicated to support the level of monitoring that's needed to implement these tools responsibly. And so that's where I think like those relationships with the vendors become really important and kind of building in pieces to the contract of the type of support they're providing, not just at the implementation, but throughout the entirety of the contract and using their tool.
Yeah, that makes a lot of sense. And I know that there's like, what is the master service agreement? Who is providing what services? And how that might be a little bit different between the academic medical centers, the AMCs, like you mentioned, versus the FQHCs. But it really becomes what internal resources do you have, and then what are the gaps that are needed in order to be able to equitably or sustainably implement. I did want to touch on a question that came up in the chat here. When you talk about metrics/criteria to decide on keeping or sustaining a tool, are you referring to tool performance, drift, or capability, validity, or clinical impact?
I think a little bit of all of the above. I think most often we're looking at shifts in tool performance because how those tools are being used or the types of patient populations can shift over time. But I also think, clinician satisfaction or the satisfaction of the end user and the patients is a really important part of that decision. So if the tool, has some new update and then it's not performing in the same way, you're experiencing performance glitches, or the new functionality is just not a great fit for the organization. I think that's also an important factor in that decision.
Yeah, I'll also add that I think for a lot of health systems right now, at least in the core network too, where they're looking at tools that have already been implemented in the last couple of years to better understand adoption practices, they're looking at how much these tools are actually being used. So going back to take an inventory of tools that have been implemented and the penetration rate or adoption rate by the providers themselves. So the tool itself might have some level of clinical impact, but I think sometimes it gets lost in all the tools that are being used in the system, and sometimes that does contribute to whether or not they decommission the tool.
That actually just reminded me also as we're seeing tools integrate and add on new functionalities, there's the potential that existing tools become redundant and might not be used as often. So it's also something to consider.
Right. And I think just kind of highlighting those ideas, I wonder if it's, again, the internal capability that organizations might or may not have to be able to see, right? Meaning there's time, effort that is needed to be able to look at. It's the governance piece. And we've been learning that, I think, all through this, that data governance is essential, not only from the vetting, but the piloting, but then the sustainability. At all facets of that product lifecycle need to be taken into consideration to be able to I would say responsibly support these tools. And then, like you mentioned, at what point it does something become redundant, no longer necessary? Meaning, at what point do you end the contract? So those are really great points. I'm going to go back to the chat here. There's a couple other things that came up here. One was around, you mentioned one organization added an HIT tool, HIT ticket for AI implementation requests. Are there other functional tools cohort members use to implement their policies?
Yeah, I think that organization in particular was using a smart sheet system. So that was how they were managing existing health IT product requests. And I think they added a new layer on to that existing functionality that included, AI specific questions. So yeah.
Thank you. I'm gonna go to there's apparently two questions here. Is HAIP seeing any vendors inviting HAIP or similar organizations at the design stage as insights from real world use would be useful in designing more effective applications? So in other words, being brought in earlier in the design for it appears like certain technology. And I think if you want to come off mute and maybe further describe this, it sounds like really being able to go earlier into the design before things become more rolled out or more streamlined within the clinical workflows or wherever the workflow might be.
Um, yeah, maybe I can take a stab at that. We're currently not involved in the design process for any tool development. A lot of our work has focused on post-market implementation of the tool and providing best practices and actionable guidance after the tool has been developed. But I think that's a good question, Ciera. I don't know if you have anything else to add to that. Yeah,
Do you want me to also take that, Ciera and Sana? Sorry.
sure.
Hello, everybody. This is Alifia. I also help. I'm also part of the DHI team and Health Air Partnership team, lead the operations and management of Health Air Partnership. Thank you, everybody, for joining. So I can answer some of that question. I think at Health Air Partnership, we try to be very vendor agnostic and try to provide life cycle management and like AI implementation, last mile implementation assistance. So we do surface on the ground real world challenges, but we don't necessarily work directly with vendor in design stages, not at this stage. And the second question, do you see Health AI partnership having tool-wise, area-wise knowledge sharing? As I was mentioning, I think for now, we are trying to be use case agnostic too, right? Like trying to figure out, because I think there's lots of questions that need to be answered on, right? How do you even set up governance? How do you set up monitoring maintenance, vendor engagement, and all of those, like just operational infrastructure and processes, and there's a lot of work to be done in that space. Not to say that in future we might not have like area or use case specific guidances, but at the moment there's a lot of wealth of stuff that needs to be done, yeah, within the operation.
Sounds great. Thank you so much.
Mhm.
Yes, thank you. Thank you so much, Alethea, for sharing that. And thank you, Ciera and Senna, for your presentation. I know we're going to transition over to our closing slides, but we just want to say thank you so much. And I think that one thing that I will highlight and elevate is that there is wisdom in community, and the community of practices that you all have, as well as the resources, I think is a wealth of knowledge. And we look forward to learning more as we go along. And so thank you again so much. And so with that, I think we're going to put up some slides real quick to close this out so that we have enough time to transition. We would love to know what topics are you interested in us covering in future AI in Action webinars. This webinar series is supported by amazing partners, and we have these on a monthly basis. And we do have some that are already planned, but we are interested in hearing what are you all interested in us going out into the field and learning so that we can elevate too. So please, if you can, share that in the chat. We'd love to either, if you know something, that'd be amazing. But if not, even if just things that are coming up for you that are most important and relevant in AI adoption and safety net, that would be great for us. And then with that, I'm going to hand it over to Wes that will share a little bit about our upcoming events.
Thank you, Elkin. Yes, just before we all sign off from the hour, as was mentioned, we have this is a monthly webinar series. We took a break from July in the summer, but we're resuming again. We have our next two AI in Action webinars featuring one of the Practice Network sites, North Country Healthcare, sharing some of their insights in their process on September 11th. And then also Culture IQ and the California Healthcare Foundation presenting on October 16th. Anyone registered and attended this webinar, you'll receive the registration links in those follow-ups, but for now you can save those dates. And then also here at the Center for Care Innovations, we have our Safety Net Innovation Summit 2025, the theme of which is Wayfinders Community Innovation for Uncharted Times. We'll send the link to register for that in the follow-up email as well. You all are invited. It'll take place in Berkeley, and more details in the follow-up email will be sure to follow. So with that in mind, we'll give you about 2 minutes back. Please complete the survey that's there in the chat. Thank you, Ciera, for giving more insight into North Country Healthcare's presentation next month. Please be sure to register. You'll get all the follow-up in the email within the week. So thanks again. We'd love to hear from you. Share with us how you'd like us to shape these AI in Action sessions. And again, thank you to the HAIP team, Ciera and Senna, Alethea as well for presentation today. And have a good rest of your day, everyone.